want to get this right to us on a graphic here as well, because it's important to know postpartum depression is only one of a wider spectrum of perinatal mental illnesses that we need to look at. So here comes the graphic, and again, wow, there's an awful lot in here to take in. Is there any one here that seems to be more prevalent or that rises to the top?
You know, the postpartum depression is the one that most people think is the most common. But with the postpartum depression, there's also the postpartum anxiety that I think a lot of women experience that they don't really pick up on those early clues, and the OCD as well. Panic disorder isn't as common. Post-traumatic stress disorder, you know, it's not as common. The psychosis, it's about 1 in 1,000 births. Mm-hmm. And then you can also have bipolar that is set on, you know, from that pregnancy as well.
So how do you then diagnose all these different mood and anxiety disorders that we have here?
Right.
How do you start the diagnosis, the diagnostic process?
Well, the one thing you look for, has my symptoms lasted more than 2 weeks? And then are they severe? If you've had symptoms more than 2 weeks and they're severe and you feel hopeless or helpless and you can't get a hold of your feelings, you really need to seek medical consultation. Follow up with your medical doctor, tell them how you're feeling, talk to a family member, and maybe they can help you get some counseling or get to a medical doctor.
And I think there's something else that you dropped in there too, which is important. This doesn't happen immediately after birth. This takes a couple of weeks, but the average I'm seeing is a couple of weeks, or at least that's the number that I see that is always being pushed out there. Is that an average, or does it fluctuate?
I think it fluctuates. I mean, it can happen in the first 2 weeks to a month to several months after you deliver the baby. However, the symptoms, you may have had the symptoms all along, maybe after 2 weeks, maybe at a month, and they just got worse and reared their ugly head as the months went on because you weren't able to get help, or you didn't recognize that you needed it, or your mother or a family member or someone said, it's the baby blues, they'll go away.